Okay, good afternoon, everyone. My name is Meredith Bond from the City News Digital team, and I am joined today by the Psychedelic Frontier producer, Pat Taney, Patrick Moulden, the main subject of the documentary, and Mark Howard, CEO of Iboga Soul, one of the companies featured in last night's documentary. For more information on the documentary, or if you didn't get a chance to watch it last night, the link in the description will take you there, and you can read all about the other stories we've posted over the last week. So for today, Pat and Mark and Patrick will be answering all your questions live. If you would like to ask a question, you can simply just write it in the comments and we will hopefully have the chance to answer. Thank you so much for joining us, guys. Just to start off, Pat, what was your experience like shooting this documentary?
Yeah, so this was a very interesting journey, and we began research in this late last year, really taking a look at, early last year, taking a look at mental health. That's what we approached. We wanted to do a documentary about mental health. We thought it was important. I've spoken to many experts who said we're facing a crisis right now when it comes to mental health. And the more I did research, I kept coming across psychedelics on message boards, research studies that are showing this could be a breakthrough treatment in mental health issues, PTSD, anxiety, and depression. And the more we looked into it, we were surprised and just amazed by the amount of studies that have been done by Johns Hopkins University, NYU, showing incredible promise that in these clinical trials, showing things like psilocybin, MDMA are really helping to treat mental health in study participants. So from there, we started casting a wide net to try and find people who have either tried psychedelics, experts who are studying this on the front lines, and we wanted to really be Canadian focused. So we hit companies that are based here in Canada. And that's how I met Mark Howard with Iboga Soul. And he hooked me up with Patrick Moulden, who I hope if you watched the documentary, you saw his incredible story. This is a man who served our country in Afghanistan, witnessed some pretty horrific things, and was willing to take a psychedelic, one he really was hoping was going to change his life, and invited our cameras to document the whole thing.
Mm-hmm. And Patrick, what's been the response since the documentary aired last night? You were mentioning you've heard from a lot of people since it aired less than 24 hours ago.
Yeah, it seems like every time I look at my phone, I've got a new email or text or a lot of support from a lot of my friends, that I haven't seen or heard of for a lot of years, but also a lot of interest from people that I've never even met or asking me about, how to get in contact with Mark, just questions about the whole process and showing a lot of interest in it. So it feels good to, shine a light on this and hopefully help some people that are suffering that don't need to be.
Mm-hmm. What do you think people hope, what do you hope people got from hearing your story?
That there's another option, like the traditional 12-step recovery. It's not for everybody, like there's not one way to recover to get sober that's right for every single person out there. So it's an option, it's a tool in the toolbox, and it's worth exploring if you feel like you're beating your head against the wall. And mental health, the mental health and addiction kind of go hand in hand, and it can shine a light into some dark places that for you and help you process it in a way that is then enables you to let it go and put it behind you. And so it's not like you're operating the rest of your life kind of dragging a ball and chain behind you or with one foot stuck in the door. It sort of allows you to face whatever that darkness was, sever that tide, let it go, and move on with your life with it like a restart, So I recommend it for anybody, and like I said, it's a tool, and it gives hope, and it's a plant, for God's sake, it comes from the earth. You know what I mean? It's not a pharmaceutical nightmare that leads you to other pharmaceutical nightmares. It's a way out. It's a one-time kind of a thing, and that you don't have to go to the fucking pharmacy. Sorry. And re-up your methadone prescription however, so I don't know. Yeah, trauma. It's well, I've talked about that already. I don't know. Ask me smart questions.
Talking about the plant a little bit, Mark, could you explain a little bit about Iboga if someone didn't catch the documentary last night?
It's a natural plant medicine from the earth. It actually comes from a root of a plant called Iboga. It's grown in Africa. I mean, they are growing at different places in the world and things like that, but it retains its real good medicinal qualities, which are classified as an alkaloid. It's very powerful. You have to, really learn how to use it. So I studied in Africa and I studied in Costa Rica, and I spent, years training to study to use it before I used it. But it has a very profound effect at allowing someone to go into a space where they can access, deep memories and a deep consciousness, which clears away the sort of like the clutter and the clatter, and allows someone to contact themselves, their own soul, to have that one-on-one conversation with themselves and really get, a clear view of, what's going on with them in their life.
Mm-hmm. How does it differ from other psychedelics that might be more well-known, like LSD or mushrooms?
Meredith, how do you differ from me? Your hair is a little different. You have dimples. I notice. I don't. You're female. I mean, you're a human. I'm a human. Plant medicine and plant medicine, but we're different. You know what I mean? So it's really hard to sort of classify. And the one good thing about Iboga is, it allows the person to experience, to witness an experience that's individual to themselves. Each one of those medicines offer that. They're like Pat said about having a tool in a toolbox. Iboga sits on top of a pretty mighty plant medicine throne because it's very powerful in accessing not only the physical and the spiritual, and it has a lot of qualities that, that allows someone to really clean and their life out and start a new path. All these medicines have their abilities to do that. So they're all unique. I would say it's really hard to compare them like apple and oranges. I would say the word I like to use is complementary, and they have each have a sort of a role, and that they can be used to help people evolve or become more spiritually aware, which allows them to live their life to the more fuller capacity.
Mm-hmm. This could be a question for both Mark or Patrick. What made you want to participate in this documentary?
I'll start. I've worked for, I've been working for about 10 years with the medicine. Like I said, about 4 years training and about 6 years working with hundreds of clients. I have another documentary called Dosed, where I was, really involved with working with a lot of really heavy addictions. As time progressed, the fentanyl crisis, has replaced heroin and made things extremely difficult. And so I pushed myself to the limits of what I can do. So the next arena that I needed to enter as, a gladiator of plant medicines was to get the word out to as many people as possible hey, look, there's something here that works. Let's get the research done. Let's get people on board. Let's change the way people are using the modalities of healing towards mental health. And then let's create like an army of love to sort of go after this and actually make a real serious change.
Mm-hmm. And Patrick?
Sorry, what was the question? Why did I get involved?
Yeah, well, what made you want to participate?
Yeah, well, Mark, first of all, is my best friend. We've been friends for years and years, and I've seen him save so many lives, and so we've been in touch, even though I live in Hamilton, Ontario now, we stay in pretty close contact, and he knew, that I was struggling and presented me with this opportunity, and I trusted him. I do trust him with my life, and so I said, of course, let's do it, because what I'm doing obviously is not working, and I know that you can help me and save my life, like straight up.
Mm-hmm. How have you been doing since the documentary aired? If you like to share.
Oh, since it aired?
Yeah.
Like yesterday?
Or no, sorry, since it was first shot in the months. Yeah.
Well, I mean, every day, like I say, after my Afghanistan experience, every day above ground is a good day, So every sober day on top of that is like a gift, like really a gift. And being so far in such a dark place for so long, you know, to experience that sobriety is still just seems like a miracle, but it so exciting. Like every day, the everyday challenges, you know, that come up for everybody every second of the day are not like a life altering chaotic situation for me anymore. You know, it's fun, and life is good, and I love sleeping. I love waking up. I love having gratitude for life and all the things that, you know, you take for granted. You lose sight of their importance when you're in active addiction. It's really tragic. So
and if I can jump in, Meredith, just from seeing Patrick, you know, Patrick, we first met over the summer, and I just, you know, from that interview, I mean, you had the entire film crew in tears because you are a very expressive person, and we could see the pain, we could see the anguish, and we could see the desperation. And to see where you are today is remarkable. And, you know, we've been checking in with you even after we finished filming over those several months, and you're running again, you're back into artwork. What was it about the Iboga? And I know you mentioned it in the doc that, you know, this wasn't, oh, I take a bunch of medicine and I'm better. But what was it specifically, do you think, if you can walk the viewers through the post after we left you at that art show, how the Iboga continued to help you?
Well, like I said, I think of it as like a reboot, you know, like dumping all of the old garbage files that's building up in your hard drive, you know, that's slowing down your system and you know, not allowing you even to take a full breath, you know. It's like flushing all that out, and I feel lighter. I feel excited. I feel like energized to be able to be in a place, a state of mind, physical and mental, where I can strive for things again. You know, like outside of my military career, when I lost that, I was so devastated, and I didn't even realize for a long time that my whole career, my whole life, I was always trying to get to the next level, you know, and achieve things within the military that most people weren't able to do. And so to not have that anymore, or anything really to push myself, you know, I feel like I have that now, you know, and at the beginning of every day, if that is just simply expressing gratitude, you know, for the bed that I got to sleep in last night and the sleep that I got, you know, that's a much better way to start off my day and face things than hating life, you know, looking for the next fix, or just like being distracted by something that's not in line with my true destiny. You know, I feel like I don't still maybe really know what that is, like if it's art or whatever, but I'm not worried about it because I'm moving in the right direction towards whatever that is. And it's exciting. It feels really good to be clean and to be proud, to be able to look myself in the mirror and like what I see, and take care of my body and my temple. And yeah, like, I don't know, yammering, but
that's great.
So we actually have a question from the audience that's kind of on the same line. What happens next? Is this an ongoing treatment, or is it just the once and then it works from there?
You know, what people saw in the documentary, in terms of the psychospiritual, was like, you know, it's sort of like, let's say, you know, someone comes in and they've got a massive wound. You have to get in there and clean it all out, you know, and before the healing can even start. You know what I mean? And then you got to go to the doctors and get the bandage changed, and, you know, while it's healing, get it flushed out and get it cleaned. And then even after that, it takes time to heal. Pat has been doing medicine with me. You know, it was like, there's so much more that was going on behind the scenes of this whole thing, but it's great we show it. But afterwards, we've done Iboga probably, you know, 7 times or something, or 6 times, like maybe smaller amounts, but not microdosing amounts, but bigger than microdose in between, just to constantly keep in check and keep cleaning it out and keep in check, just like that. This is an ongoing therapy. Is I mean, really, you need to recover for the rest of your life. You don't need like a 1-year plan or a 2-year plan. You need like a rest of your life plan. Sometimes that's hard to tell people in the beginning because it becomes too much to chew at first. So, just let's take the first step. Let's go through one Iboga journey. Let's see where we can get. But the reality is that we need a lot of people on board and a lot of support to continually help people stay in check with their healing and, and to not allow that wound to open back up and fester.
Pat, I was going to ask you, what was the most interesting thing you learned while shooting this documentary?
The most interesting thing I learned was honestly watching Patrick's journey and seeing someone who initially was hurting so much. And then we really were using him to pose the question, can psychedelics treat mental health conditions? And I think Patrick and everyone will agree with me that he was in a really bad spot. So we didn't know which way it was going to go. And to witness him, going through the therapy before and getting the health checks before and getting cleaned up from his addiction before in itself is monumental. And then also exposing yourself to the world and undergoing this ceremony where you're not sure if there's going to be a good end result or not. I think that was the most interesting thing to me. Other side notes, just the entire industry, how much it's grown over the past year. I mean, when we casted the net, as I told you in the beginning, there were so many companies, too many to count, that have been launched in the past year, trying to get into the psychedelic arena. And what's interesting is that this huge movement is gaining so much traction right now, based on the scientific studies I cited at the top of this conversation. And these, now we have Canadian companies like Numinous that are on the front lines. They just received approval through Health Canada to study psilocybin mushrooms, psilocybin, the psychoactive compound in magic mushrooms. So the entire movement and the push right now to take these drugs from underground to mainstream was eye-opening. I mean, I came into this, like many who probably watched the documentary last night, thinking, magic mushrooms or LSD. Sure, people may have tried those in university. They were a thing of the 60s. They treat mental health. What? And I got a lot of comments from people I know or on Facebook and messages saying, well, I should be cured of depression from my years in university because of my experiences with psychedelics. But that's not what it's about. It's not, and I think Patrick and Mark alluded to this. The other interesting thing was, I think the misconception is that you go out and you take psilocybin or Iboga and you're better. And why it's called psychedelic assisted therapy is the fact that it assists other traditional therapeutic methods. So yes, you still do some of the hard work. You still have to meet with a therapist. But as Patrick mentioned, and watching him go through this, what it did was allowed him to take a deep dive into himself, revisit some pretty horrible places, which none of us want to do. With this medicine, things like Iboga and psilocybin, from what I understand, help you revisit those places and see them from a different point of view and realize that neither your present nor your future need to be defined by past moments, no matter how horrifying they are. So the whole thing for me was incredibly just eye-opening, and it'll be very interesting to see where the industry goes from this.
What do you think the biggest hurdle in bringing psychedelic drugs from kind of the underground to the mainstream is, besides illegality?
So it's the studies. We still need more conclusive studies. I think Dr. Roger McIntyre made that clear in the documentary. The other issue, which we also touched upon in the show, is the scientists on the front lines right now have to be very, very careful. And if anything were to go wrong with clinical studies, in their science, how they take care of these mushrooms, any of that stuff can be detrimental to the entire industry. So I think you have people who are, very responsible about this, really working hard to make sure what they're doing is ethical and stays above the law and the rules. And, they really want to make sure they're going to get it this time, because, clinical trials have been done decades before and they kind of were swept under the rug. This time you've got a lot more money involved and you have a lot of real scientists backing this. So I think, like Dr. Evan Wood said, there's every possibility that we might see psychedelic assisted therapy legal in Canada in the next 2 to 3 years.
Wow. So, that quickly, I was going to say, where do you kind of see the market being in 5 years? Is it
Yeah.
going to be something that it's like cannabis now?
Yeah. And that's what they're comparing it to. We spoke with a financial expert who's been talking with investors, and they see it as going down the same route. One thing that's different about this, where cannabis, for most psychedelics at least, for cannabis, that's a product you can develop and sell to a client who uses it daily, weekly, and they'll keep coming back to get the medicine. Psychedelics is different. Psychedelics is not okay, I'm a pharmaceutical company, I'm going to get involved because you're going to be on this medicine for weeks and years to come. So you're going to keep refilling your prescription and we're going to keep making money. That's not where the money is. In this, the money is in the labs. The money is in the clinics that are going to be developed. The idea is that we're going to see psychedelic therapy clinics, much like Mark has in Iboga Soul down in Costa Rica, where you'll go and it's almost like a retreat. So they're psychedelic spas, but on board are medical staff, therapists who will actually walk you through the experience. So for some people, it might be, I'm going to go to a clinic, I'm depressed, and I'm going to take psilocybin, and I'm only going to need like one massive trip to understand my depression and get better from that. But you'll stay 3, 4 days, 5 days, whatever the models they'll create in this psychedelic spa and go through the post therapy and understand a little bit more about the experience you had. So that's where the money's going to be in this. So it'll be very interesting. Like I said, so many companies are out there right now, all racing to the finish line, all trying to figure out what is the best model to make money here. But I think most are in agreement that clinics are going to be a big moneymaker.
Mm-hmm. Mark, do you anticipate seeing an increase in requests about information about your company, Iboga Soul?
Yeah, I'm sure. I mean, it's one of the things that led, like I have another documentary, like I said, called Dosed Out, and I got a lot of, and it's hard to watch and not be able to like help these people. That's why it's good that the public awareness is going out right now. And I know in my heart, it's like, I've seen way too much success. I don't need clinical trials to tell me what's up. It's great. And I can't wait for it to happen. I'd love to be a part of the research, but it's so blatantly obvious. I would, that's why I put myself out here. I would double, triple down on this. I mean, it's just the way it works. And yeah, I expect to see, of course, right? Like, I mean, water is going to find its own level, and every stream leads to a river, leads to an ocean, and it's a cycle. It evaporates to the sky and it rains. Like it's going to run to the source of truth. That's where we're all going. And so this is just a main line to truth, right? So definitely there's going to be more people inquiring because it works.
Mm-hmm. Definitely. We've gotten a few nice comments actually on our Facebook Live. I'm just going to read a few of them out. Dee said, wow, Patrick, your soul is shining. So glad for your journey of healing and making it through such a dark time to come out and see your true worth. And another from Kim, who said, it's so great to see natural therapy and plant medicine moving into the mainstream again. So that's kind of the goal that you see, is to have these drugs be used as a mainstream treatment for mental health and addiction, correct?
Yep.
And how does that work to someone who might be suffering from those conditions and want to try this out? What would they do? How could they go about getting access to this?
I think they can reach out. What we're doing now is like, so I'll explain one plan that I think is really important to decide here, to understand. Anyone, like, so there's the addictions. Underneath an addiction is a trauma and pain, but there's a physical nature to an addiction. If someone's on a substance, that needs to be taken care of. And that's what I call pre-tox. So you need these, say you have a rehab center that's medically sort of institutionalized, medically overwatched, people can be saved. They have medically assisted doctors that can help people get onto things that could take them off the street drugs. And then they use like Ibogaine or these powerful medicines to slowly step somebody off. So it's called pre-tox. You need to get someone safely clean first, right? And that's where a lot of these centers will pop up, because then what's next is like a center where someone can go through what I call a detox and then a psychospiritual. So it's going to be someone finding out, what is it that they want to come for. is it an addiction to food? Like if it's an addiction to food, you might not need to go to a fully medically assisted pre-tox. You still might, but you might be able to go to a center where you can just have space and time around good people. But it's going to be categorically organizing this movement into the proper steps that's necessary to get someone from here where they, are having trouble and struggling to here where they're like, shining and dancing.
Definitely.
And, I want to jump in here if I can, Meredith.
Yeah, of course.
Patrick, one of the things we discussed way back when we first met was your, passion behind this also was for other war veterans, because you know what you saw in Afghanistan and many, many others have witnessed similar horrors. What do you hope in that regard for military veterans like yourself who have come back from the battleground? How do you think psychedelic assisted therapy can help them?
Well, the suicide rate it is higher than the total number of soldiers that were actually killed in Afghanistan, and that statistic alone is begging for something radical to change. More guys have killed themselves than were actually killed in combat over the course of that mission. That's a very sad statistic, and that's kind of like because I lost my career. I lost my career to a mental health injury, and I think that could have been prevented. That could have been handled a different way. Like if I was treated properly instead of heavily medicated with pharmaceuticals, because once I got heavily medicated with all the pharmaceuticals that they had prescribed to me, I was then no longer able to do my job. Like I was then categorized as a medically unfit. I was a diver in the Navy, and you have to be totally clean and above the medical standard to be able to do that job. So once I was diagnosed with this mental health injury and then prescribed all these pills, I was then medically found unfit to do that, and ultimately that led to me losing my career. I got medically released, and so I think that if there was a better way to do that, to retain the member and not lose a whole career, your identity, your lifestyle, I joined when I was 18, for God's sake, like I had 25 plus years and then all of a sudden just gone because of something that's completely out of my control. It just seemed unfair. And I see this now as a much better way to go about doing this. And I'm not saying that it's going to be right for everybody, but it's an option, that is worth exploring to retain people's careers and lives instead of just medicating pharmaceutically and then releasing with a pat on the back and see you later. Like that whole process just seemed not right at all. And this way, I think that it's pretty radical, it's pretty drastic, but so are the times that we're living in,
right?
The answer.
Well, we're just about to wrap things up, but if there's any final words any of you had to say, maybe Pat can start just about the documentary. Anything you'd like to share with the audience?
I just think if you haven't watched it yet, do yourself a favor and take a look. citytv.com. You can see the Psychedelic Frontier. I think it really captures the moment we're in right now with psychedelics and where we can possibly go with this. And, the question is still out there. Is this the best answer? I think, based on Patrick's experience, he'll say yes, but Patrick also touched on that maybe this isn't for everyone, but it is, as he mentioned, worth exploring. It'll be interesting to see, where this goes. I think, from the experts I spoke with, when it comes to treating mental health, we haven't had real breakthroughs in antidepressants in years and years and years. And for some people, they just don't work. So it'll be interesting to see as more clinical trials come out, where this industry will go.
Any final words, Mark or Patrick?
I'll let Pat speak last. Listen, if there's someone out there, listening to this or sees it, just, know that, what we were showing, that, everyone has a light inside them, like this candle, your soul, you have a light. And, with depression and drugs and all this kind of stuff, and the way you speak to yourself, it can really, dim that light. You can cover that light up, So I just, start talking to yourself nicely and let this message show you that light. Start using your light to like shine your way, and just have trust that your soul can help you find the avenue that's going to suit you best. Be patient, but be vigilant. There is a way. There is a way. And you need to let your light shine some light on that path and begin to take the steps towards it. It will happen.
Well said. Yeah. And just to add to that, from my own perspective, that light that Mark's talking about, it's always going to be there. It's never, ever going to burn out. And no matter what you think or how dark it can seem, it's always going to be inside there, and you can find it and tap into it, and it can burn bright again.
Psychedelics or no psychedelics, that's a wonderful answer. And I think
It
we all
is.
can agree on that.
It's a lovely note to end on for
Yes.
sure. Yeah. So thank you guys so much for joining. If you do want to watch the documentary, the link to it is pinned in the comments on this Facebook Live as well. So you can just click on that and it'll take you right to it. Thanks again for joining us, guys. This is a lovely discussion.
Thank you.
Thanks. Have a great
Bye-bye.
day.
You too.
Bye.
Bye.